Now to a 12 News investigation exposing how a company that promised to provide health coverage for retired police officers, firefighters, and their families was able to operate without a license here in Arizona. Yesterday, the I-Team broke the story that the state shut down Thin Blue Line here, effective immediately.
This after the I-Team's Katie Wilcox first exposed complaints that the company was failing to pay medical bills for months. Katie is joining us now with internal records from state regulators. Katie?
Right, Mark Caribe. Thin Blue Line said on paper that they weren't an insurance company and state insurance law didn't apply to them. But the first responders who were paying monthly premiums thought they were getting real coverage and now want to get their bills paid.
Right now, I'm on a forest fire in northern New Mexico.
Show me around a little bit. After 35 years with the Phoenix Police Department, retired Captain Tom Himmis won't stay away from the flames.
My purpose here is a medical support team.
So even after you retire, you're still out there?
Yeah, a lot of retired firemen find a lot of peace in coming out here and being part of a firefighting community after retirement.
Himmis is one of thousands of retired police, firefighters, and their family members who paid monthly premiums to Thin Blue Line, thinking they were getting health insurance, until some found out the company wasn't paying the bills.
Me personally, $20,000.
$45,000.
I do have appointments that I need to make, which I have not done because I knew that they weren't paying.
Yeah, I'm freaking out now because we had the surgery and then I looked last night and it popped up on the bill.
Retired Sergeant Don Bloom served more than 20 years on the Paradise Valley Police Department. He said between surgery for his wife's heart and another cardiology appointment,
They say I owe $89,470.
Bloom, Himmis, Chris Smith, and Susan Huff are among the 4,600 Arizona members of Thin Blue Line. Since January, state records show the company collected nearly $6 million in premium payments. And we don't know how many bills it's failed to pay.
I've been fighting off collections for quite a while.
Thin Blue Line said it only serves retired first responders and their families. The company promised to cover the gap.
How many of you are under 65?
Between retirement and Medicare, which kicks in at age 65.
And they started off awesome until, I don't know, whatever it was, October of last year when things started falling apart.
Last fall, members reported longer delays and larger bills until a fallout in December. The I-Team first revealed Thin Blue Line's major partners, Cigna and Quilt Benefits, cut ties, citing a lack of funds to pay claims.
Said Cigna wasn't with them and they were going to be self-pay, and, that wasn't what I signed up for.
The company's founder, Anna Reed, never responded to multiple requests from the I-Team, but in emails to clients, the company said be patient. Bills will get paid. All the while, Thin Blue Line continued to say on paper that they're not an insurance company at all, but an association health plan.
It can be a murky area for insurance regulators, right?
Sarah Leek works for a nonprofit, nonpartisan research company, which raised red flags on these kinds of plans before.
It was hard to know in some cases who's regulating these.
And state regulators also seemed unclear. The I-Team obtained internal emails where investigators said they had no jurisdiction because the company was offering self-pay plans. But on March 4th, one investigator did share 12 News' reporting in an email. That same day, records show a supervisor agreed an investigation should be open. And then on July 16th, the state issued a cease and desist order demanding Thin Blue Line stop operations immediately. The state found the company was not a benefits association and was selling insurance without a license.
You want to talk about a group of people that doesn't take kindly to that. You found them.
Right, so what happens next? Well, the state has ordered Thin Blue Line to contact all of its members and return unearned premiums. The company is also facing a legal battle in Ohio, and owners could face criminal penalties. But members are still worried about getting their bills paid and also getting insurance. So I have contact information for the Department of Insurance on 12news.com right now.
All right, Katie, thank you so much.